great to join the Sektor conference online. This is the way we do things nowadays. We are halfway through to be masters in remote working. I calculated that we might be like 4,000 hours in now, and 10,000 hours of anything makes you a master. That's what I've heard. So in half a year's time, we'll all be masters in online events and remote working. But that's not what I'm talking about with you today. I'm here to discuss data-driven innovation, but especially data-driven innovation at the time of the pandemic. How can we use data science to address the challenges which this situation has created for us? And especially, how can we do data right when we tackle the challenges of the pandemic with data? It's easy to slip into practices which wouldn't be acceptable in normal times when times are exceptional. And that's something we have to keep an eye on, because anything we do once, we are prone to do again. And we have to be conscious about the choices we make with people's data and people's privacy in these times. First, I'll provide you with the basics of data-driven innovation so that you know where I come from. So I lead the program at the University of Edinburgh called Data-Driven Innovation Initiative, which is building on the shoulders of giants. So Edinburgh has been one of the places where data has been used from the 18th century. Here's a beautiful picture of the trade balance of England, done by William Playfair, a Scottish scientist in 1768. And we've been busy with data ever since. This is the home place of economics, econometrics, and this is the home base, one of the home bases of artificial intelligence research in the world. The code breakers, Irene Young, Donald Michie, joined the university after the Second World War and launched the second AI lab in the world after Stanford in 1963. Of course, AI was very different in those times as was robotics. We've come a long way from the robot Freddy 2, which builds Mechanos there in 1971, to the NASA Valkyrie robot we host nowadays in our National Roboterium. We also host a home base for Alan Turing Institute in Scotland at the university. However, something has changed to the past 15 years. What's happened is that the connection between basically any sector active in the region in the UK and data has become stronger. And there's a buzzing digital ecosystem which have been created around domains like fintech, gaming in Edinburgh and around the university. And that is on which we are building the data-driven innovation program. This is a legacy picture. It's the last picture of Theresa May smiling with Nicola Sturgeon. I don't think they ever met after this. This is 2.5 years back when the city region deal of Edinburgh and South East Scotland was signed. We are part of that contract. We've been funded under the city region deal, and it's a £661 million initiative which we are building here around data. And we are altogether part of £1.3 billion city region deal. And the unique aspect of this particular regional innovation and regional investment program is the strong presence of data in it. It's almost half of the budget of the program. How does it all work? At the heart of DDI is a trustworthy, secure, resilient data analytics facility, which we called Edinburgh International Data Facility. In practice, it consists of supercomputing power, lots of cloud-based and physical storage, and strong networking capacity. And what we do want to do in EIDF is to be able to work with sensitive data, but also make it available in anonymized format for researchers, for innovators including private sector companies, so that we can use data to work across multiple domains, from agri-tech to healthcare to financial services. I will provide you with some examples later. We are building repositories of data sets, terabytes of data from different sources, and we are hosting it securely in the Scottish National Data Safety Haven. That's combined with the expertise of the university and our entrepreneurs in the domain of data. Digital skills and talent, especially fed in by the School of Informatics, which is the largest of its kind in Europe, and connected to all the other colleges of the university. So our informaticians work with doctors, they work with human and social scientists, they work with people from agri-tech. And we are weaving data and informatics into the structures of the university and the industry sectors of the region. At this point, we've chosen 10 sectors we are starting with, and they range from your usual suspects like health and social care. We do know that data plays a major part there, same as in fintech or digital technologies. Also to domains like tourism and festivals, which is a very Edinburgh thing. I'm not sure if you have been at the Edinburgh festivals, but it is the largest, it used to be the largest ticketed event in the world after the Olympics. 1.1 million people every year come to Edinburgh to enjoy theatre and culture. And of course, that's one of the domains which has been severely disrupted by the pandemic. This year was the first year after the Second World War in which Edinburgh festivals were not organized. So one of the domains which does need to change at this time. Examples of ongoing work. Just at the beginning of August, we launched Global Open Finance Center of Excellence. Horrible acronym, GovCo, we might change that. But anyway, Global Open Finance Center of Excellence, which brings together UK, all the major stakeholders in the United Kingdom and elsewhere in the world who deal with open finance and open finance data. What we want to do is to help companies to manage new innovations made possible by open finance data, support the fintech sector, but also work with service providers and with people who are worried about the repercussions of open finance for privacy, for management of people's data. We want to help companies which make it easier to understand what's done with your financial data. Where is it stored? How can you access it? How can you ensure that you own it? Other example from a different domain, it's our £20 million collaboration with Legal and General Advanced Care Research Centre. And this is a true multidisciplinary collaboration which spans across sectors from obvious ones, health and care, elderly care, to culture and creativity as the important part of keeping people active, sports, and even divinity. How can we ensure that we remain active, we can live a better life for longer when we reach our older age? And this is, of course, a global phenomenon. The whole world is aging, and we need to help the population which is aging to be active, more capable of living their lives happy for longer. The investment, the £661 million, goes largely to 5 innovation hubs and the EID facility which we are building. So we're actually building physical new places here, which are roughly connected to our industry sectors. Edinburgh Fusion Institute covers the largest amount, from fintech to tourism to creative technologies. Usher Institute is devoted to health and social care and the public sector innovations. Base Center Digital and Space, and National Rotarium, of course, robotics. Easter Bush takes care of agri-tech. And first ones are ready. Base Center is a buzzing center, which we just reopened at the beginning of August, which brings together researchers, innovators from companies and from the university to work under the same roof. And unfortunately also nowadays breathing the same air. And that again will be a challenge. How do we make these centers for the foreseeable future more virtual than they used to be? Stuff which is coming down the line, National Roboterium, a collaboration with Harriet Watt, is going to be opened in 2 years' time. And then the year after that, the Usher Institute. And this is the home base for the health and well-being innovations on which I'm going to focus on in the main part of this presentation. What have we promised then to the government is that the university will do things it not normally always does. And that these come in the annoying acronym which forms the word TRAIT, Talent, Research, Adoption, Data, and Entrepreneurship. TRAIT. We have promised that 62,000 to 100,000 data scientists are gonna be graduating through our programs. Almost 700 million of additional research funding, 1,000 companies using data better, at least 1,000 datasets made available for innovators, and 400 new companies either established or scaled up over the timeline of 10 years, which the program runs. We started in 2018, we are going to complete in 2028, and then capture the results 5 years after that, following the main program. But of course, data is a debated topic nowadays. And what's increasingly obvious is that our punchline of doing data right has to be at the real heart of the DDI program, and has to be at the heart of innovation we do around data. It's easy to misuse data. It's easy to monopolize data. And like any companies, our major big digital companies do want not necessarily misuse, but use data for their advantage, and they want to own it to their advantage, as companies do. And we need to be able to create counterforces, regulation, and practices which balance this out. Digital businesses become monopolies much easier than any other businesses before. Had Google been an oil company, it probably would have been regulated already. Since it's a data company, it's taken longer for the governments to wake up to the fact that these companies are de facto monopolies. And in data innovation, what we need to be able to do is to basically solve an unsolvable equilibrium. To be able to support innovation, which means agile access to data and ways to use data in unforeseen ways. At the same time, develop regulation which doesn't stifle the innovation in unhealthy ways, while protecting privacy and people's individual rights so that they can benefit from innovations which are being created. And we discuss about topics like buying services with your data, and you can be master of your data, and if you want to use customized services, you give it away. But frankly, that deal currently isn't a fair deal, because hardly any individual is informed enough to actually understand the repercussions of their choices. When they click, I accept the terms. Do we understand what we click? I would doubt that hardly anybody really does. Nobody reads the small print. And can we make this work better so that everybody would benefit? Our choices would be clearer, and we would be trusting more those people who hold our data on our behalf. How do we make this process far more transparent than it currently is? We are studying such ways as data trusts, places where you can hold data safely, which are not owned by companies, ways to use Creative Commons-like licenses for data, they're sort of called My Data licenses, which make it possible for you to manage your content better in a recognizable way, and making a division between hosting your data and owning your data, which isn't the same thing. On these domains, I thought I will now give you an example, and then we can go back to discussing the wider repercussion. This is something we have done because of the pandemic here in Scotland at a very fast scale. So it's a subset of a project called NHS Data Log. It's Data Log and not Lake because we are in Scotland, of course. And the vision of the data log is to establish a data repository which holds all local, regional, national health and social care data in a safe format, native format until it's needed, making it linkable, defined, accessible, and machine readable. Our original development phases for the data log have been to go from concept creation last year to alpha test this year and then live production environment in 2022, at which time we would have full operational structure supporting very large data sets, an innovation hub connected to those data sets, joint partnerships with external companies and other stakeholders, and iterative development. And the main promise of this is that we would be able to ask new questions from old data and connecting old data and new data when we seek for answers in health and care. However, the pandemic happened. And what our researchers did at a very fast pace was to decide to ramp up the speed of development for data log so that it could serve the data integration needs of COVID-19 doctors. And basically what we are doing here is to put together the data of the patients, all from all people who have been tested for COVID, build a biobank of the same patients connected to the data bank, build a community of clinicians, academics, and especially data scientists supporting them, and then create an outcomes-driven approach to use this resource so that we can evaluate new tests and find new pathways to care, to go to from your normal patient care to data-driven patient care and policies. Oh, this is a bit messed up slide. Sorry about that. Anyway, what has now happened is that we moved from a 2-year delivery timeline to a 3-month delivery timeline. We have released a prototype 1 in April already, first minimum viable product at the end of April, and live release at the end of May. And now, when we are in September, 30 projects have been run on NHS Data COVID-19 Collaborative using the patient care data from patients of all of Scotland, and we have made significant improvements in the way we treat these patients based on the analysis we've been able to do by connecting the information from COVID-19 symptoms to their previous health records. This is just to show the wideness of the data sources. So we have connected together dozens of data sources from different domains of patient care into one accessible data registry. And that is, of course, property of NHS, is hosted in our data safety haven. It can be accessed by researchers, but it all the time remains in the data safety haven. So it's not jeopardized or compromised in any way. That's a success story. But there are also other stories regarding COVID-19 and data. And I want to close this with a more generic discussion about what is the coronavirus actually. Because people have referred to it as a black swan, ooh, the black swan came, nobody saw it coming, and it sort of disrupted our lives. But actually, it's not a black swan, it's a gray rhino. So black swan, if you know the term, means an unforeseen, unexpected, disruptive event which lands on us and fundamentally changes the way we operate. While a gray rhino is a pre-known existing threat which has been there for a long time, which everybody knows is there, and nobody's done anything about it. So when it happens, when it tramples in the room, we knew that it was on the courtyard, but we didn't do shit, frankly, to try to address that. And coronavirus is a gray rhino. WHO and other stakeholders have warned us for years that we need to be prepared for pandemics. And what have the governments done? Well, that didn't happen last year. It didn't happen. It happened the year before that. We'll shut down these operations. We don't keep up these reserves. We don't keep these people on the payroll who are there, just waiting and rolling their thumbs while the pandemic never happened. And that's happened in Europe, many countries. It's definitely happened in the United States, where the national resources for managing these kinds of events have been shut down by Donald Trump's government before these series of events started. And what that then implies is the question of data surveillance. It's been said that we need to gather all the data to be able to manage the pandemic. What it's worthwhile to ask, did we actually have lots of this data already? Did we just fail to use this data? And if that's the case, and when that's the case, where are the actual real data gaps? What are the things we do need to gather and collect which we don't already have or didn't already have? And all the data gathering should be based on this analysis, and not just data for the sake of it, but data for the actual need. In general, data comes in two camps, and one is problematic, the other less so. The less problematic, which I think data log is an example, is specific data for a specific purpose. In the case of COVID-19 collaborative, we gathered the data because we wanted to make the diagnosis of COVID-19 better by combining the diagnostical data from these patients to their previous health data, so that we can see the connections between different health conditions and COVID-19. It's done transparently by NHS. It's available, it's documented. Whereas far more problematic are the attempts to gather generic data about who moves in the city and where. Generic data for a generic purpose and opaque processes, and the different face recognition systems introduced by global governments is a good example of this. You install them, you gather the data, nobody knows what's done with it. What's the need for this data collection? And data alone doesn't really work unless it's connected to a trust element in the society. Let's think about the situation in the USA at the moment, where the division between Republican and Democratic governments have turned the society into kind of battleground. And the main victim of that battleground is trust. Neither of the sides trust the other side. And that fundamentally means that even if the authorities do have the data, they would make data-informed decisions. Unfortunately, in the case of the USA, they don't, but if they did, people wouldn't trust them because they don't trust the authorities. And we do see it in these rebel movements around, also in Europe, German demonstrations, smaller manifestation of the same. You don't trust anything you've been told by the authorities, so why would you trust the health information they provide you with? And then that is connected to the growing movement to also challenge science as a source of information. And people are losing the trust to experts because, again, some politicians have been using it as the tool to progress their careers. I happen to live in a country where that unfortunately is the case, with Boris Johnson saying we had enough of experts. So, to conclude, what is not needed is to hoard new data and pour it into broken systems where it's used in unforeseen, opaque ways to do something. What is needed is a thorough analysis of the way we use data at the time of the coronavirus pandemic. Where have the failure points been? What kind of reforms should we be doing? And what are the ways we should manage and control this data in a ways which is transparent for both the people whose data it is, you and me, as well as the authorities and the users of the data who can access it. And this does call for new ways to understand the concept of data from the also personal point of view. It does call for data trusts. It does call for transparent data standards. It does call for more toolbox-like approach available for ourselves as users of data when we manage our data. Can we get new, better functioning tools to manage our data? And these are the things we want to expand our research on in the future, from dedicated cases of COVID-19 management to also more wider health and care data domains, as well as the financial and cultural sectors of our cities. So I think this concludes my talk this morning. Thank you. It's still morning in Scotland, 10:30 here. And just remember, if we do innovate with data, we must do data right. But doing data right is a challenge. So how do we balance innovation, regulation, and respecting privacy so that all of these angles can be respected to the level they need to be respected? Very good. Ready for questions and comments. Thank you. So there's a question there, how to build trust if, for example, nobody shows you how many tests they did in cities, boroughs, etc. That is an excellent question. Frankly, the only answer I have to that one is that that data must be made available, and the governments do succeed to very varying extent in this. My home country is Finland. Finland publishes their testing data as an open data repository, real time. Basically, you can go and see every day how many tests were done and where. It's an open data accessible for anybody, mostly used by media who publish it. In the UK, it's very ad hoc, and in this case of my home country, which is Scotland is much better at it, and England is much worse at it. So it does vary. Transparency is the key here. If transparency is not provided, trust can't be built. And second question, which is a good one, what should be the first step to start with data in the organization/social system? Where and with whom to start? For most organizations, data is a side product, of course. So they do something else, and data is being created while they do it. If the organization is not data savvy, then my experience is, for example, with cities, I have a background in smart cities. My experience is to start with a low-hanging fruit. Basically, you try to connect three things. You ensure that you will empower the change makers in the organization, and they can be anywhere. They are not necessarily bosses. They often are not bosses. You connect the change makers. You find the change makers who have the capability to be data savvy, or you bring them in. There are, for example, mechanisms like the in-house coders, residence coders, which you can use, that you decide to bring in a developer to an organization which doesn't have a developer. You connect the change makers with an opportunity. An opportunity doesn't have to be, frankly, transformative for the organization, but it has to be something which can be delivered on a pretty fast timeline. And then you ensure that you have the data available for that opportunity, which might need data engineering before you can do data science. So fundamentally, it's a production pipeline from finding the opportunity, then to find the data, clear the data, make the data available, and then use the data. And it's basically a growth process. You can start then. You do your first cases, you show the value, and that will create the willingness in other parts of the organization to work on data, and starts to create a data network of data practitioners in the organization. So it starts with people in a nutshell. Is there a way to identify data gaps easier than looking for them in a data system? That is most certainly the case. So it's probably easier to identify data gaps by looking at the operational sort of breakpoints. I mean, if you map your operations from a kind of production engineering, using more like a production engineering approach, like how do we operate? Does it work seamlessly? Are there ways in this production, either product or service production chain, which are broken or hard to understand or require, for example, lots of almost manual hand done integration? Those are the breakpoints. Those are the data gaps, and they are more visible by analyzing the operation than by analyzing data systems. 3 questions there. Do we have more? I was a bit quick with my press. No new questions coming up. So we have 7 minutes left. What do we do? Do we just chat around? Okay, data analytics, where to start? Well, that's a big one. I think that the main point to understand data analysis is to understand that it's one way of using data, and it's not a one part of the data production chain, and it's not a novel thing, and it's not actually sustainable on its own. So how the production pipeline of data works is that after you have basically created the need or the willingness to use data better to deliver your operations, then the first group of people you need are data engineers, and they are the people who make data available. They make data usable, and that means wrangling data out of existing systems. It means standard cleaning data so that it's clean from false information and mistakes. It means making it available in a linkable format, which can be used in data analysis. When you have enough data, which can be analyzed, then you can bring in the data analysts. And what the analysts will always give you is answers to questions based on the data they have. They won't give you anything more. If there's anything, if there are problems, if there are gaps in the data, those gaps will be in the analysis. Now, that is something we have seen in, for example, policing systems where inbuilt bias against race has impacted the data analysis. We have seen the same in insurance systems, for example, where some groups of population have been unfairly treated because the data analytics system has an inbuilt bias against certain groups of people of the society. And to tackle that, what we do need then is a third group of people, and these are actually statisticians. Good old-fashioned statisticians are needed in order to see how your analysis builds into a bigger landscape of data around either your company or the sector at large. And without a kind of connecting the data analysis results with proper statistical analysis, what we can easily get is biased results and incomplete results from the analytics. Very good. How to build trust? First steps, data analytics, data gaps. Any advice for people who wants to start working on big data analysis? Any books? Just a second. I think I have one here. Yeah, Thomas Davenport's Keeping Up with the Quants, Your Guide to Understanding and Using Analytics is a very good, sort of not quite a starter book, but an excellent book to get a grip on data analysis, which is not purely lightweight. It's pretty deep. So I can recommend this. Harvard Business Review is a bit old already, from 2017, but it's not hasn't outdated itself. Question about your opinion on dataism. Oh, that's a broad one. I guess I'm a generalist myself, so and I have a planner background, original architect, which by default gives you the mindset where you approach any challenge from multiple viewpoints. That's the job of planners. That's the job of designers. And that's, I would say, has really worked very well for me to work with people who have a more single track mindset. Any single track mindset is problematic. Dataism most definitely is one such single track mindset. So it must be, in order to tackle complex problems, the key to that is to bring together multiple ways to approach the problem. Any single track mindset is always an issue in itself, because it creates a bias because of methodologies. Then, of course, we do also see that dataism is ruthlessly efficient in many cases. I mean, nowadays, whenever we use internet services, the internet business model is based on dataism in the way that no assumptions are made. All the assumptions are tested. So whenever we use any service, any app, any online platform, we are being tested ruthlessly all of the time through multiple choice testing, where any service available for us will be available in multiple iterations for different user groups, and then the company moves the product to the direction of the best response. So, and that just works, to be frank. Where that becomes more problematic is when we try to use the same methodology for, should I say, more multifaceted complex problems, or so-called wicked problems, where there's not a one single right answer. You can't crack a challenges of aging population with only dataism. You have to understand the human being as a holistic entity, and you have to respect the complexity of the question. At some point, when the complexity of the question increases, dataism breaks down and gives you only partial answers. And I think our time is up, and that was the last question. Well timed. Thanks for the questions. It's been a pleasure. I'll be joining you on the next channel. Thank you.